I remember the day we found out. I was sitting on the couch when my parents came home and my mom was crying. I asked her what was wrong. That was the day. The day we found out my 6-month-old brother had cystic fibrosis. Here I plan to help families who have recently had cystic fibrosis introduced to their households. We'll start with a brief introduction of what cystic fibrosis is. CF is a hereditary disorder that mainly impacts the stomach and lungs. Excess mucus causes difficulty breathing and clogs the pancreas, which is key to break down fats and proteins. This results in a difficulty to gain weight for CF patients. There are medications and physio in place that tend to help patients, but nothing is 100%. The first impressions can be tough. Parents can feel overwhelmed, stressed, sad, even angry. Why their child? Why not someone else's? And even guilt. Some parents may feel they're the reason their child has cystic fibrosis. All of these feelings are understandable and acceptable, but it's important to learn how to work through them. In the early stages, it's very important to set up a strong routine. These skills will be passed on to your child when they're old enough to take care of themselves. Things such as medical trays, a physio regime, and meal planning can be very important, as there are many things a CF patient needs to focus on throughout the day. There are also many things to avoid early on. As a parent, you should be identifying situations where there are smoke and aerosol sprays, as those can be very damaging to a CF patient's lungs, as well as avoiding certain medications such as cough depressants. Part of CF is that the patient is always coughing to work to get the mucus out of their lungs, and cough depressants inhibit this ability. Sick people are also a threat to CF patients, as their immune system is not as strong as everyone else's, so that when they get sick, it can be much more drastic than for the average. And lastly, damp environments may be something that not everyone identifies with right away, but mold is very damaging to CF patients' lungs, and mold grows plentifully in damp environments. The keys to staying healthy are as following. Physical exercise is one of the most important aspects of a cystic fibrosis patient's life. Exercise works with the physiotherapy to remove the mucus from the patient's lungs. Other factors are eating habits. Because of CF's ability to inhibit weight gain, the more someone can eat, the more it will help them work through this. Staying consistent. We keep coming back to this because it is one of the most important. Missing pills or missing physio can be very detrimental to a CF patient's health. And lastly, teamwork. Although the patient may be the only one with CF, it affects everyone around them, and it can benefit them if people are working together to help them through it. As a family, a healthy family is one that works together. There are mental effects of cystic fibrosis. You will go through periods of highs and lows, and they can cause sadness, but you always have to look from the informed point of view and the bright side. There are medications out there to help. Although things may be tough, you will work through it. You just need to remain calm and stay honest with your doctors. If you happen to have missed physio or missed some medication, you need to inform your doctor. Although you may be embarrassed or you may be concerned that this is why your child is sick, it is the best thing to let them know. The more they know, the more they can help, and there is no one more informed on the subject of cystic fibrosis than your doctor. Make sure you're not missing appointments, make sure you're keeping them updated, and everything will be fine. It's always better to be safe than sorry. I hope this has helped to give families that are new to CF a brief outline on what they should expect and work towards. If you have any more questions, please visit www.cysticfibrosis.ca.